The Substance Abuse and Suicide Prevention Program is a national effort focused on substance misuse, suicide prevention, and intervention resources for Indian Country. This program used to be called the Methamphetamine and Suicide Prevention Initiative. This initiative is making a positive difference in Indian Country. How? By promoting evidence-based, practice-based, culturally appropriate models and strategies to build resilience, promote positive development, and increase self-sufficiency among American Indians and Alaska Natives.
I'm the MSPI MAT coordinator under the White Sky Hope Center, which is a part of the Rocky Boy Health Center. The issues that we're dealing with this program had to do with the high numbers of alcohol and methamphetamine and opioid use disorders. Medication-assisted treatment is medication prescribed by doctors to help our patients and clients with severe substance use disorders wean them off of the harder drugs and get them off of the substance use disorders and to gradually get them to recovery on their own.
I'm the White Sky Hope Center Division Chief. I oversee the Substance Use Disorder Program here on the Rocky Boy Indian Reservation. Our medication-assisted treatment is using Vivitrol and naltrexone to treat both alcohol substance use disorders and opioid substance use disorders. Before we started at MAT, we brought in APRN nurse from Bullhook, and she came and gave a presentation to our medical providers because I needed to start with them, understanding that some of the medications that they prescribe have some devastating consequences. We have to think about doing treatment differently, and medication-assisted treatment opens it up to not just our department doing the work, but the whole healthcare organization doing the work.
The MAT program here at Rocky Boy Health Clinic, we were the first ones in the state of Montana, the first tribe to actually get an MAT program going. How we started was through the MSPI grant. White Sky Hope Center would be the ones to meet with the clients, make sure that they had the correct diagnosis that met the protocol or met the ASAM criteria for opioid addiction severe and alcohol addiction severe. The treatment plan includes CD services and mental health services. So that, requires integrated services. It requires all of us to work together. The fact that when you see somebody come through that door who are desperate, who are hopeless, and feel like they're at the end, they have nowhere, and you see them, even 2 months down the road, and they're just like, wow, this really works, and they starting to have a sparkle in their eye, and then 6 months down the road, and then at 12 months, they've got a job, here at the clinic, and they're like muscular, and it's just amazing to see the change. It's awesome, and that's what makes it worth it.
What's the biggest positive change since I finished the treatment program is I became a productive member of the community. I hold down a full-time job. I've been 18 months sober. I guess I got more trust from my family members, my father. Doing the things that I wanted to do before I became addicted to drugs and alcohol. Other members finishing and being proud to be sober, and what I've seen changes. Yeah, and I see them holding down jobs and supporting their families, and doing their cultural ways, and participating in the activities, sober activities, and being happy and proud to be sober.
The success of the MAT program has been so effective that our methamphetamine use has gone down from 16 severe meth use disorders down to 6 in the past fiscal year. The peer-to-peer program with the MAT program involves our community to assist our clients in recovery, and it also strengthens the family. It puts recovery in the proper perspective where it's no longer looking at the addiction, we're looking at the strength of the culture, which helps our clients connect with the community, connect with the strengths of the culture. The connection with our MAT program with the community and culture has to do with the basic premise that there is no medical answer to a spiritual problem.